Go ahead, Winnie.
Hello, Ms. Cook. My name is Keller. I'm a student physical therapist here at GRU. I'm going to be working with you today, just seeing what we can do to help you improve your daily life, whatever we can do. So can you tell me a little bit about yourself? I see that you have Parkinson's disease. Can you tell me a little bit about that?
Yeah, well, I'm not really able to walk very much, and I have trouble moving around most of the day. I'm just in my wheelchair.
Okay.
People pushing me around.
So you spend most of the day in your wheelchair?
Mm-hmm.
Okay. What about any medications or anything? Are you taking any medication for?
I'm taking them, but I forget.
You forget?
I forget what they are.
You figure they are, okay.
That's my nurse.
Okay. Have you heard, do you know of an on-off phase with your medication? Have you heard of that?
Mm-hmm.
You haven't? Okay. So I'll probably ask your nurse when you had your last on-off phase,
Okay.
if you're on or if you're off right now. That basically just means how well you're going to be able to function, what I can expect. But if you have any thing that you are limited throughout the day that you're not able to do that you want to be able to do, do you have any specific goals? Because what we're going to do is work on physical function.
Mm-hmm.
Do you have any specific goals for me today that you'd like to work on?
Well, I just want to move better. I have a really hard time getting in and out of my bed and getting to the bathroom on time.
Okay, getting in and out of bed and bathroom. Okay, now
I'm
about...
just really slow.
Okay, and I understand that. That's something we can work on, definitely. And about the getting to the bathroom on time, have you noticed, have there been times that you haven't made it? Does that happen often?
Yeah. They said I might have to wear diapers, and I really don't want to do that, so.
Okay. Now, getting to the bathroom, if you don't make it, do you think it's because you can't walk fast enough or you can't get out of bed quick enough?
It's just all of it.
All of it?
I'm
Okay.
just really slow.
Okay, well, we'll work on that. All right, well, if I can, if you don't mind, if I can go ahead and I'm going to get your vitals.
Okay.
Just take your blood pressure and your heart rate and things like that. So, I'm just going to come right over here and I'm going to get your heart rate. Just relax. Okay, your heart rate is 64, which is good. And I'm going to go ahead and take your blood pressure. Go ahead and put this on. Okay, well, I don't know what's wrong with that. We'll just pretend it works.
Great.
Alright, blood pressure 170/60.
You're not inside out.
Okay, well, that's why I use my own equipment. Alright, so, and now get your heart rate one more time, just to make sure. Okay, the respiratory rate's a little high, it's about 22. So, there's some things I've noticed that I want to work on with you. One thing is, I know that you kind of are hunched forward a little bit, and that does make it, have you noticed any difficulty breathing or anything like that? Do you have trouble catching your breath sometimes?
I guess so.
You guess so?
I don't
Okay.
do a lot.
Okay.
My
well,
bones won't let me sit up straight.
yeah, I know. We're going to work on trying to, though. So I'll teach you some things. We'll try to work on some mobility through the course of our treatment. And we'll work on trying to help you get a bigger and deeper breath, especially since we're going to be doing some activity. You might get short of breath. But real quick, I want to just check and make sure you're not having any issues with what we call DVT, which can be just a little clot formation in your legs. I just want to make sure you don't have that before we get up, make sure you're safe. So I'm looking for redness or swelling in each one of your legs. I want you to tell me if you have any pain with this. Feeling for nodules.
No pain.
Feeling for nodules, checking for pain.
No marks or redness.
Okay, good. All right. Now, since you do have a little bit of decrease in your breathing, I want to just listen to your lungs, make sure there's nothing in there. Have you had any trouble coughing, or have you noticed having to cough anything up?
I mean, sometimes I feel like I can't cough.
Okay. Okay. Well, we'll work on that too. We have some interventions we can do to help you cough. All right. So I'm just gonna. What I want you to do whenever I touch down on your chest in different areas, I want you to take a deep breath for me in through your mouth, out through your mouth. Okay. All right. Deep breath. Good. 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 Now come under the shirt here. Under the shirt there. One more time on each side. And here. Okay. Did I notice anything here?
There are decreased breath sounds in the lower lobes.
Okay.
No crackling or anything.
Okay. Now we want to go and do the auscultate the back side.
Same on the back side.
Okay. So we definitely are. You didn't have any fluid in your lungs or anything, which is great. But there are some decreased breath sounds, meaning you're not quite getting as deep a breath as you would like. So we'll work on that. Okay. The next thing I want to do is I want to get you over here on the mat. We're going to just check out your skin. And actually, I'm gonna check a test real quick. But what I want to do is check out your skin. We're on the mat, and then we'll stay here, and we're going to do some things, work on some mobility and things like that. So if you could, if you don't mind, I'm going to get in here and just relax. Checking for rigidity. Don't do anything there. Can you take this arm, and can you just do out to the side like this for me? Excuse me. I'm going to do the same thing to the other side?
Let me do this thing.
Not yet. Okay? Can you do that for me? Point out to the sky. And okay. Rigidity there. Alright. Let's take this off. Can you pick your leg up for me? Good. Okay, you can set it down. Same thing on this side. Good. Okay. You have trouble picking up your legs on your own without using your arm?
I just feel kind of weak.
Okay. Okay. All right. Now I'm going to do the same thing here. Okay. Can you tap this toe for me up and down like this? Okay. All right. Good. On this side. Stay relaxed on the other side. Tap this toe for me up and down. Okay. All right. How about, can you kick one leg out? Okay. How about the other one? Kick it out. Big, 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 big. Good. Okay. So you're able to do a little bit better when I kind of tell you, let's make it big, let's make it big. So yeah, that's good. We'll work on that. I'll show you some things we can do. Maybe even do some things. Tell yourself, I need to be big. I need to be big.
Okay.
Okay. All right. Now, let's. I'm going to have you go ahead and we're going to move to the mat. I'm going to move you help you move to the mat, and can I put the scapegoat on you?
Yeah.
Just for safety.
They use those all the old folks.
All the time, huh?
Uh-huh.
All right. Raise your arms up for me. Nice and big. All right. Is that not too tight? Too tight? Not too loose?
It's okay.
Okay. Goodness. Teeny little waist. Okay.
You should have seen my waist back in the 50s.
Back in the day? Alright. So I want to see just how well you're able to stand, and all I want you to do, stand up, and then we'll come over here, slide to the edge. I want your knees to touch the back, and then we'll reach down and sit. Okay? Alright, and if I could have my aide assist me, I want to check the skin on the back of her legs and her bottom of her sacrum when she stands. Okay, nice and hang on just a second. So you might, let's get that out of the way, let's make sure these are locked. Okay, now show me how you can stand, let's see it. Okay, how about you sit back down? Alright, so one thing we can do before you stand is we can rock. So I want you to, I'm going to kind of give you as good posture we can get. You can rock forward, so rock 1, rock 2, and rock 3 up. So I want to try and get your toes under you.
Okay.
Get your nose out over your toes. Flat back, chest up as best you can. Rock over. So see how I'm over my knees?
I might fall forward if I do that.
I won't let you. I'll be here, and my aide's right here in front of you, and he'll help you. So go ahead, and we'll sit up nice and tall, the best you can, and we're going to rock. Rock 1, rock 2, and up on 3. Rock 3. Come up, come up, come up, come up, come up. Very good. Okay. Now I'm just going to check the skin back here, looking at the bottom, back of the legs. Okay. Now, and my aide, you can just assist right over there. Can we just walk towards? Stand up nice and tall. Look up, look up, look up at Brian. Okay, now turn towards me. Big turn, big turn, big turn, big feet. Alright, do you feel the back there on the back of your knees?
Yes.
Okay, have a seat for me, nice and slow. Okay. Now you don't notice any pain in your feet or anything like that? You have never had any cuts or anything on your feet? Okay. Now, while we're here, what I want to do is I want to work on trying to sit up straight, nice and tall. And then we're going to lay you down, and we're going to work on you getting up, like you're getting up from out of bed, and we're going to walk. Okay, and I'm going to time you and see how long that takes you.
I need to use my walker to walk.
You do? Okay, well, we'll have it there for you. Okay? And I'm going to time you and see how long it takes you to get to that piece of tape right there. So we'll pretend like that's your bathroom, and you're trying to get up and go to the bathroom.
Okay.
And your rolling walker is right there. Okay? So now, about the posture. The best thing we can do is try and roll these hips forward and then sit your chest up straight. So you want your chest up and out. It's almost like you're looking up. That's much better than how we were. So really get the hips forward. And I know we're going to be kind of restricted, but this is better than what you were.
Okay.
Now while we're here, can we work on breathing?
Yeah.
Okay. So you're here right here. I want you to take these arms and make them big, big. Just make a big Y with your arms. Best you can. And breathe in deep. And try and sit up nice and straight when you do it.
That's all I can do.
Okay, and back down, that's fine. Big, big up, big up, big up. Come on, come on, come on, come on, come on, come on. Good, deep breath, nice. Back down. One more time. Big, big up, big up, big Y, big Y. Nice and tall. Good. Okay. So one more thing to do to help you breathe. This isn't too tight, is it?
No, it's okay.
We want to try and breathe through what we have. We have a muscle right here called your diaphragm. So when you breathe, you want to kind of use it and not use so much your chest because you don't have a lot of motion to get your chest up. So we want to expand your diaphragm, almost like you're breathing through your stomach. So pretend there's a balloon in here. And when you breathe in, you want to go, fill up your tummy. Fill up your tummy with air. Poke out your tummy. Fill it up with air. And if you can't, let's see. Try it. You're doing it well. How about you put your hand there and see if you can feel your hand rise up and down. Good.
I feel it.
Very good. And if you ever have trouble getting that started, you can sniff really fast. And you'll feel it.
Oh, yeah.
Yeah. So we'll keep working on that, and we'll keep doing that, and hopefully improve your breathing. That's something you can work on throughout the day. Because you don't expand here as well as we'd like. Okay? So we'll work on that. So, I'm going to move this chair out of the way.